Hey guys, good morning. I'm Dr. Shaun Jones. I'm Clinical Director at Trinity Mall Medical Center in Montego Bay. And I wanted to just briefly say something to you about vaccines because there seems to be quite a lot of misunderstanding out there. And a lot of the misunderstanding is obviously driven by those people who have spoken about the vaccines and really don't understand it. Now, it is being said that the vaccines don't protect you from getting infected. That is absolutely false. And the reason that is false is that we need to understand, or people need to understand, how the medical community shares information. Now, you might recall that earlier during this whole pandemic, you had a lot of people who started talking about the efficacy of the vaccines and which vaccine is better than which. The reason they were talking about which vaccine is better than which is because they were using some numbers that the medical community had published with respect to the efficacy of a vaccine. So let's use Pfizer, for example, that has an efficacy of between 90 and 92%. What does this number mean? When the testing is being done, before the information is shared with the public, the people who are being tested, they are given the Pfizer vaccine, and let's say you tested 100 people. So you have 100 people who got the vaccine, and you place those 100 people in a room, and you expose them to COVID. The efficacy represents how many people did not get infected because they had the vaccine. So with Pfizer at 92%, it means that when we give 100 people the vaccine and we expose all of them to COVID, 92 people do not get infected. Probably 8 will get infected simply because they had the vaccine. If all these people were exposed to the COVID virus without being vaccinated, everyone would have become infected. So that's how you understand what we mean when we say that the vaccine actually protects you from infection. But guess what? Because this is medicine and this is medical science, there still were 8 people who got infected. So we are going to come to you and we're going to say to you that the vaccine is not 100% efficient. You still can get infected. But the fact of the matter is that 92 people were protected. What about those 92 people? They actually were protected and did not get the infection. So the fact of the matter is the vaccines protect people from becoming infected. The other way to look at how vaccines function in protecting people is that example I gave you is an example that relates to the individual in terms of how vaccine protects an individual. Now, let's look at how the vaccine protects the population. So the example we looked at was how it protected individuals. So let's look at how this vaccine would actually protect the population. Now, let's think of when somebody gets infected with COVID, someone who is not vaccinated. On average, this person will be contagious for 14 days, which is why we have our quarantine time set for that. So let's look at it simply that way. So let's use 14 days. So this person who is unvaccinated, they get the COVID infection, they are contagious for 14 days. So let's picture this person as somebody who works in a bar who is exposed to 10 people per day. Now they get the COVID infection, and as you know, some people are asymptomatic, so they don't even know that they have the infection. So they are contagious for 14 days, and they are exposing themselves to 10 persons per day. It means that they would have passed on this infection to 140 persons during those 14 days. Now let's look at the difference if this person was vaccinated. Now, if we recall that example, we had vaccinated people who could still possibly get the infection. But the difference is this: when these people get the infection is a much milder infection, and the infection lasts for a much shorter time. So this vaccinated person working in the bar, instead of being contagious for 14 days, they might only be contagious for 5 days. What does that mean? For those 5 days, they would have only been exposed to 50 persons. So instead of passing the virus to 140 persons, they would have only passed the virus to 50 persons. What does that mean for vaccination? It means that the one vaccine that we would have given this individual would have actually protected those 90 persons who did not get the COVID infection simply because this person was less contagious for a shorter period of time. So, ladies and gentlemen, this is how we look at it. So it's not only about protecting the individual, which we are able to protect the individual, but it is about the general effects for the rest of the population, which we achieve when we have someone vaccinated. So, guys, with all the love, listen, Go and do your part, get yourself vaccinated, and if you have other questions that you need to get answered and so on, reach out and we'll be here. We will be doing a couple more videos to help to explain what is happening, but for now, wear your mask. Remember, social distancing is still important, and for those people who are vaccinated like myself, please remember we still need to set that example. We still need to do the right thing. We still need to wear our mask, still need to keep the social distance, and still need to keep down the numbers in our gatherings. All right? So much love. Stay safe out there. Take care.